Hi guys, this is Dr. Cyril Benedict. Welcome to my YouTube channel PhD Medicine. Let's crack PhD from exam point of view. So in this video, let's see basic measurements in epidemiology. Our previous class was on tools of measurement. Rate, ratio and proportion tells us how to measure something. Okay, how to measure in epidemiology. After knowing how to measure, we should know what to measure. Okay, what is that we should use these tools to measure. Okay, so this answers the question what to measure. There are two things to measure in epidemiology. The first thing is mortality, the next is morbidity. So what is mortality and morbidity? Mortality means being susceptible to death or being mortal, whereas morbidity means being in an unhealthy condition or being in an unhealthy state due to a disease or an illness. Let's see one by one. Let's start with mortality. Mortality is actually a very good public health indicator. It indicates the public health state of a community or a region. So let us begin with the indicators of mortality. It is called as indicators of mortality, and there are almost 4 to 5 indicators of mortality. The first and the most important or the most simplest being crude death rate. Crude death rate. So what is crude death rate? Crude death rate can be termed as number of deaths per thousand people in a population in a year. It is considered as the simplest measure of mortality. Why? Look at the formula. Crude death rate is crude death rate is number of deaths in a year divided by mid-year population. So number of people dying in a particular region in a year divided by the mid-year population in that particular region. What is this mid-year population? Mid-year population is nothing but the average of the population in a particular region in a year. So when will be the population be at an average level? On July 1st. Okay, so usually it is measured on July 1st. The population of a particular region, that is on July 1st, is called as mid-year population. So this crude death rate accounts deaths due to all reasons, deaths due to each and every particular condition. Okay, that is crude death rate. That is why the word being crude, all reasons. Next indicator being specific death rate. So this specific death rate, the word specific means specific to any particular groups, for example males, females, infants or elderly people, or it could be cause or disease specific. Okay, so if we make a small tweak in the previous formulae, we can understand what is called a specific death rate. So the formulae for specific death rate goes like this. Let us assume we can calculate, let us assume we can measure specific death rate due to heart diseases. Okay, so let us make this tweak in the formula. Specific death rate. Okay, it means number of deaths due to heart disease. You just add this thing, number of deaths due to heart disease divided by mid-year population. Okay, number of deaths due to heart disease in a region in a year divided by mid-year population. So remember, crude death rate accounts for deaths due to all reasons, whereas specific death rate, in our condition, specific death rate related to heart disease accounts for only the deaths due to heart diseases in this particular region in this particular year. Okay, that is specific death rate. The next indicator of mortality is case fatality rate. This case fatality rate is considered as the killing power of the disease. Okay, killing power of the disease. It is usually measured for acute infectious diseases or deaths due to acute infectious diseases. Now let's see the formula for case fatality rate. The formula for case fatality rate goes like this. The numerator is number of deaths due to a particular disease. In this example, number of deaths due to COVID-19 divided by total number of people who were affected by COVID-19 at that particular point of time in that particular region. So imagine there were 1,000 people who were affected by COVID, and out of this 1,000 people, who were affected by COVID, 100 people dies eventually. So what does this mean? It means COVID-19 kills 10% of its patients. Okay, the disease is so fatal in a way that it kills 10% of the people who are affected by it. Okay, so that refers to the killing power. So in this case, the killing power of COVID-19 is 10%, because imagine, should 100 people be affected by COVID, 10 of them will die. If 1,000 people are affected, 100 will die. If 10,000 people are affected, 1,000 people will die. That is the meaning of the 10%. Coming to the next indicator of mortality, that is proportional mortality rate. So the key thing to understand in proportional mortality is it describes the burden of the disease in a community. This is the keyword. Okay, so let's see the formula. The numerator goes like this: number of deaths due to heart disease divided by total number of deaths. So imagine, in a country in the previous year, 1,000 people have died. Okay, just an imaginary situation. Okay, 1,000 people have died due to all the causes combined together. Out of this 1,000 deaths, 100 deaths were due to heart attack alone, or MI, or heart disease alone. So what does this tell? 1,000 people were dying in that region. Out of this 1,000, 10% of the diseases were attributed only to heart disease itself. So the burden of heart disease in that particular community is 10%. Should the burden reduce, if you are gonna prevent this heart disease, 10 percentage of the deaths of 10 percentage of all the deaths could have been prevented. So this gives the number to the policy makers to enable them to curb or control certain diseases. They will understand that if you control this particular disease, how many people will be saved from dying in that particular country or in that particular region. So that is why proportional mortality rate is considered as the one that describes the burden of the disease in a community. In our case, the burden of heart disease is 10%. Now let's come to the last indicator of mortality. It is called as infant mortality rate, or IMR. So infant mortality rate, the formula goes like this: number of deaths among infants who are less than 1 year old divided by total number of 1,000 live births. So infant means a baby which is less than 1 year old. So the rate that an infant is dying due to illness or health conditions is what is being measured as IMR. So for every 1,000 live babies that are being born, how many infants are dying in a particular region or a country? That is what is called as infant mortality rate. So there is one more thing to understand in or remember in this infant mortality rate is this infant mortality rate is also a part of another indicator called as physical quality of life indicator, or PQLI, physical quality of life indicator. This infant mortality rate is a very essential part, or a metric in that PQLI. So now let us see certain factors that affect the mortality rates or the mortality indicators that we saw above. So let us see certain examples which increases the mortality rates. There are few, like birth rates. So it is often documented that increased birth rate is often related to increased infant mortality rate. The next is population density. Population density means the number of people living in a particular square kilometer. Okay, so the more overcrowded a particular city or a town is, the more will be its population density, or more dense will be the population. So what happens when there is overcrowding? There will be larger families, there will be inferior housing, eventually poverty, and all these will lead to an increased risk of infection, finally leading to untreated disease, which could lead to increased mortality, that is increased death. Finally, epidemics. What is an epidemic? A sudden increase in the number of cases of a particular disease in a community, which is otherwise the prevalence would be normal in that particular region. Okay, so should there be any epidemics, it will lead to increased mortality rate. So these are the factors that affect mortality rates. So when this question, basic measurements in epidemiology, is being asked, you should start. There are two basic measurements. There is mortality rate and morbidity rate. Write the definition for mortality. Write the 4 to 5 indicators. At least write 4 of the 5. Okay. Explain what are those 5 indicators, give a small definition, especially write the formulae along with an example. Write the formulae with the example already incorporated into it. And finally, write the factors affecting mortality rate. And finally, remember, it's not important when do you start. What is more important is you start or not. Thank you.